Hello, this is Dr. Mario Gonzalez of Elmore Medical Vein and Laser Treatment Center of Fresno, California, viewing an endovenous laser treatment procedure on a very nice lady who presented with lower leg swelling, calf ache, calf fatigue, and even some bulging varicosities. Her sonogram revealed that she has an incompetent Great Saphenous Vein that you can see on the far left, as well as an incompetent small saphenous vein on the right. The incompetence is due to the small valves in the vein having been disrupted, and so we have turbulent flow with much of the blood flow having been reversed to go down towards the ankle instead of up towards the heart and lungs. This is problematic because, number one, the blood is not getting oxygenated on this trip, and number two, we see a lot of blood pooling down in the ankle and in the calf, which causes the swelling, and over time will cause some skin changes as well as the possibility of bulging varicosities. Avoidance of all of these complications is paramount. What we will attempt to do is seal this vein or these veins with laser therapy. This procedure is done in an office setting and for the most part is quite comfortable, even without any sort of sedation whatsoever. As you can see here, I am using a needle and a syringe, and I'm placing some of this local anesthetic just right underneath the skin, and this will make the entire tract over this fiber numb. So we will be using lidocaine throughout the procedure. Here I've anesthetized an area in the skin, and I'm using a very small incision so that I may place my needle through this small incision. I can then look up at the monitor, place the needle into the appropriate vein, and when I've confirmed this, I can also slide a guide wire through that needle, which is going to be used then to direct my laser fiber introducer into the vein. Here, I've confirmed we're in the vein by aspirating some blood, and that's the guide wire being fed into the vein. That will then be used to guide the white introducer into the vein, and the wire will then be removed and will allow me to place the fiber in. With the fiber now in place, I'm taking another needle and I'm using it to deliver saline solution with anesthesia around the vein itself. This is done while I'm looking at the sonogram. The laser fiber is depicted as that bright light in the middle of the screen, and the fluid will be dark on the sonogram. So you can see the fluid is now building up around the fiber itself. After this is accomplished, the laser's fired and slowly retracted back. The fiber is now out of the skin and the fiber is coming out. As you can see, the monitor is right over to the patient's left and was used to visualize the entire procedure. So the compression stocking is being placed by the nursing staff. This stocking will be worn during the day for the next 3 weeks for comfort as well as efficacy of the treatment.